All right, for our last module, we have a module about child abuse and neglect. Like I said, this is an important topic to me, but also should be to you as well as educators. I feel like we can be the number one source of being able to prevent child abuse and neglect if we know about it and understand it. Definition of child abuse and neglect. The U.S. federal government defines child abuse and neglect at a minimum as any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of serious harm. Another definition is this definition of child abuse and neglect refers specifically to parents and other caregivers. A child under this definition generally means a person who is younger than age 18 or who is not an emancipated minor. So this has specifically to do with parents and caregivers. Any recent act or failure to act. This reminds us that abuse and neglect are two distinct concepts. A child can be harmed by blatant actions like hitting, kicking, but also a child can also be harmed when an adult fails to provide for the child's well-being. For example, by not supervising a toddler or not feeding or bathing a child or not supervising during bathing time of an infant or toddler. So all of those can be abuse and neglect. On the part of the parent or caretaker, remember, abuse and neglect can happen anywhere and by anyone. Abuse does not just happen at the hands of a parent or family member. It can also be performed by anyone who is responsible for the care of a child. This might be a teacher, a coach, a faith leader, or any other individual in a caregiving or supervisory role, which results in death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of serious harm. We don't have to wait for tragedies to strike. If a child is at a serious risk of harm, it can be considered abuse or neglect. So it doesn't have to, it doesn't have to actually happen. But if there are actions or something happening that could involve an imminent risk of danger, that can be abuse and neglect as well. In Minnesota, we're going to just kind of talk about different definitions of child abuse and neglect. Physical abuse means any physical injury, mental injury, or threatened injury inflicted by a person responsible for the child's care on a child by other than accidental means. Physical or mental injury that cannot reasonably be explained by the child's history of injuries or an aversive and deprivation procedures or regulated interventions that have not been authorized by law. So for example, throwing, kicking, burning, biting, or cutting a child, striking a child with a closed fist, shaking a child under the age of 3, striking or other actions that result in non-accidental injury to a child under the age of 18 months, unreasonable interference with a child's breathing, threatening a child with a weapon, striking a child under the age of 1 on the face or head, striking a child who is at least age 1 but under the age of 4 on the face or head, which results in an injury, purposely giving a child poison, alcohol, or dangerous, harmful, controlled substances that were not prescribed by the child's doctor, or punishing the child, giving the child substances that affect their behavior, motor coordination, or judgment, or that result in sickness or internal injury, or subjecting the child to medical procedures that would be unnecessary if the child were not exposed to that substance. Unreasonable physical confinement or restraint that's not permitted by law, including but not limited to tying, caging, or changing. And then in a school facility or school zone, an act by a person responsible for the child's care that is a violation under corporal punishment. Substantial child endangerment means that a person responsible for a child's care by act or omission commits or attempts to commit an act against a child under their care that constitutes any of the following: egregious harm, murder in the first, second, or third degree, or manslaughter, assault in the first, second, or third degree, malicious punishment or neglect or endangerment of a child, parental behavior, status, or condition that mandates that the county attorney file a termination of parental rights. Threatened injury means a statement, overt act, condition, or status that represents a substantial risk of physical or sexual abuse or mental injury. In criminal law, bodily harm means physical pain or injury, illness, or any impairment of physical condition. Substantial bodily harm means bodily injury that involves a temporary but substantial disfigurement, causing a temporary but substantial loss or impairment of the function of any bodily member or organ, or causes a fracture of any bodily member. Great bodily harm means bodily injury that creates a high probability of death, causing serious permanent disfigurement, or causes a permanent or protracted loss of impairment of function of any bodily member or organ. Neglect. So this means the commission or omission of any of the acts specified below other than accidental means. So failure by a person responsible for a child's care to supply a child with necessary food, clothing, shelter, health, medical, or other care required for the child's physical and mental health. Failure to protect a child from conditions or actions that seriously endanger the child's physical or mental health, including a growth delay, which could be referred to as failure to thrive, that has been diagnosed by a physician. Failure to provide necessary supervision or childcare arrangements appropriate for a child after considering such factors as the child's age, mental ability, physical condition, length of absence or environment, when the child is unable to care for their own basic needs or safety. Failure to ensure that the child is educated as required by state law. Prenatal exposure to controlled substance use by the mom for non-medical purposes, medical neglect that includes but is not limited to withholding medical treatment from a disabled infant with a life-threatening condition, and then chronic and severe use of alcohol or a controlled substance by a parent or person responsible for the care of the child that adversely affects the child's basic needs and safety. So those are all definitions of neglect. We already talked about substantial child endangerment, but one thing is one thing that we need to think about is with child endangerment is that it means a person responsible for the child's care by act or omission commits or attempts to commit an act against the child under the care, which constitutes the following. So abandonment, and then also neglect that substantially endangers the child's physical or mental health, including a growth delay, which could be referred to as failure to thrive, that has been diagnosed by a physician. Sexual abuse means the subjection of a child by a person responsible for the child's care, by a person who has a significant relationship to the child, or by a person in a current or recent position of authority to any act that constitutes a violation of the following. So criminal sexual conduct, solicitation of children to engage in sexual conduct, communication of sexually explicit materials to children, any act involving a child that constitutes a violation of prostitution offenses, child sex trafficking, and then threatened sexual abuse, which includes the status of a parent or household member who has committed a violation that requires registration as a predatory offender. Substantial child endangerment means that a person responsible for care by act or omission commits or attempts to commit an act against a child, such as sex trafficking, solicitation, inducement, and promotion of prostitution, criminal sexual conduct, solicitation of children, use of a minor in a sexual performance, sexually exploited youth means an individual to whom where any of these apply. So a sexually exploited youth is someone who is alleged to have engaged in conduct that would, if committed by an adult, violate federal or local law relating to being hired, offering to be hired, agreeing to be hired by another individual to engage in sexual penetration or conduct, is a victim of the crime of criminal sexual conduct, is a victim of federal offense of child pornography, and is a sex trafficking victim. Emotional maltreatment means that consistent, deliberate infliction of mental harm on a child by a person responsible for their care that has an observable, sustained, and adverse effect on their physical, mental, or emotional development. Mental injury means that an injury to the psychological capacity or emotional stability of a child. And then neglect includes emotional harm from a pattern of behavior that contributes to impaired emotional functioning. We're almost done with definitions, I promise. So abandonment is presumed when either of these apply. So when the parent has had no contact with the child on a regular basis and it has not demonstrated consistent interest in the child's well-being for 6 months, and the social services agency has made reasonable efforts to facilitate contact unless the parent establishes that an extreme financial or physical hardship or treatment for mental disability or chemical dependency or other good cause prevented the parent from contacting the child. The other way is if the child is an infant under the age of 2 and has been deserted by the parent under circumstances that show an intent not to return to care for the child. Where does child abuse and neglect occur? So there's two different places, so familial and institutional. Familial abuse or neglect occurs when a child is in the care of a parent or another family member. This could be in the child's home, while in the car with the family, at the store, in the parking lot, before school starts, or other places in the community. The act of abuse or neglect is performed by a parent, guardian, or other person designated to provide care. This also includes siblings and babysitters. Institutional abuse and neglect occurs outside the home in a community or private setting, such as schools, religious organizations, community groups, extracurricular activities, while the child is in the care of a non-family member. So this type of abuse or neglect is also known as out-of-home or extrafamilial abuse or neglect. This type of abuse typically involves a child, an adult in a supervisory role, like a teacher, caregiver, volunteer, coach, any of those types of positions. Institutional abuse and neglect, some common things that we've seen is binding or restricting a child's movements. You cannot punish a child by preventing them from being able to move or speak. Corporal punishment, you may not under any circumstances strike, hit, whip, spank, pinch, yank, push, drop, or use any other form of physical punishment on a child of any age. Isolating a child. You may not punish a child by leaving them alone. Leaving a child on the playground alone because they did not line up with the group, or putting the child in timeout in an enclosed space like a closet, restroom, or cardboard box. We cannot do that. Withholding physical needs. You cannot, under any circumstances, withhold food, sleep, physical activity, or other needs like toileting from a child. Yelling, shaming, belittling, or threatening a child. You may not, under any circumstance, intentionally make a child fear for their physical or psychological safety. You may not call children hurtful names, threaten children, or make children feel shame. Who is at risk? Child abuse and neglect can happen to anyone. There is no typical abuser or victim. However, some situations that are associated with higher levels of abuse and neglect are there, right? So a lot of times the higher risk levels for abuse and neglect are young children, especially 0 to 3, because that's when they need us the most. They're very demanding. They're not independent yet. That's when a lot of like crying happens or colic, those types of things. Children with disabilities, mainly because the disabilities make it hard, right? So when we have parents that are struggling and then you add on a child with a disability, that can be really stressful to them. And then children with challenging behavior as well, it can also, increase that stress too. So understanding who is more at risk for abuse and neglect can help us provide extra support to children and those families who are experiencing stress. We can think of risks as occurring at several levels. So it can occur at the individual, the family, and the community level. So if we know we have young kids, right? The one thing I think about is like postpartum depression with moms and with dads is we need to make sure that they have supports. Children with disabilities, that's why we need to have our resources ready to go so that we can help families out with those kiddos. And then children with challenging behavior, again, have those resources ready, being able to help support that family and how to navigate the behavior issues. Who is at risk? So this means children who have a difficult time communicating, controlling their emotions, following directions, or getting along with others might be at risk. The adults around them might get frustrated easily or not know how to help the child. We must be careful to remember this does not mean that the child causes abuse and neglect. Okay, so when we're talking about the most commonly high-risk groups, we're talking about kids, but we are not saying that they are to blame, right? The child is never to blame. It also does not mean that only children in these categories are abused and neglected either. So we must remember to provide extra support to families whose children meet those characteristics. The hopes and dreams parents have for their child begin during pregnancy. Okay, we all, when moms are pregnant, we think about like what our kid is going to be like, what are we going to be like as parents? We have all these hopes and dreams of what it could look like. And sometimes the reality of caring for an infant or toddler might not match the expectation that the parent had. Okay, especially if something goes wrong during birth, or, maybe the baby is born with some sort of disability that they didn't know about during pregnancy. That can really change a lot of things in a hurry. So this can be stressful for families and can make them vulnerable to abuse and neglect. So it's really important to just provide all families with a lot of support and resources if we can. So again, let's talk a little bit about who is at risk. Adults with little knowledge of child development or a history of maltreatment as children are at increased risk for abusing or neglecting a child. Adults with substance use issues, mental health concerns, or a harsh approach to discipline may also be at risk. Abuse is also more likely to occur in families that are socially isolated. Child abuse and neglect is also more likely to occur in families that have experienced other forms of domestic violence, like violence against a spouse or a partner. Families experiencing stress, such as unemployment, the birth of a new child, marital conflict, deployment, Poor parent-child relationships or negative interactions also are more at risk. And then community risk factors also can come into play too, and that can include community violence, high levels of poverty, high levels of mobility and housing instability, high unemployment rates, and poor social connections. So with that, we want to talk about protective factors. What are some things that we can do to protect children? So one thing is we want to strengthen families, right? So some of their protective factors is parental resilience. Families are able to manage stress and bounce back from challenges. Knowledge of child development and parenting. If adults know what to expect as children grow and are able to meet their child's needs at each stage of development, that can help prevent some abuse and neglect. Social connections. Families know there are people who care about them and who they can call on for help. And it doesn't have to be family members, right? Like you need to find your tribe somewhere. Sometimes people feel so isolated that they have no help. So we need to make sure we help kind of make those connections or be that connection for them. Concrete supports in times of need. Families can get help when crises strike. So food, shelter, medical, mental health services, social, legal, and educational resources. That's where your resource list is going to be helpful. And then social emotional competence of children. So social emotional development promotes healthy relationships with others, and children with strong relationships who can regulate their own behavior, express their emotions, and relate to others are at a lower risk of maltreatment. So that is why in the preschool world of things, we focus a lot on social and emotional competence of children and teaching those. So what is my role? So as a caregiver for infants and toddlers, you have a legal and ethical professional responsibility to protect children from harm. When I would start every school year, I would tell the kids as we were making up classroom rules that my number one job is to keep you safe, right? Learning can't happen if kids don't feel safe. So as a caregiver, your number one job is to legally and ethically provide um, provide them and protect them from harm. As a child development program staff member, you are also a mandated reporter. So this means you are legally required to report suspicions of child abuse and neglect to the appropriate authorities, including law enforcement and child protective services, which we'll talk about in just a little bit. So we need to make sure we know how to recognize the warning signs of child abuse and neglect. We all want to keep children safe. And so to do so, we must also be able to recognize when a child is in harm's way. It's not always easy to recognize child abuse and neglect. And remember that some of these signs by itself does not necessarily mean a child has been or is being abused or neglected. Oftentimes it's a pattern or a combination of behaviors that will lead you to a suspicion of wondering if the child is experiencing abuse or neglect. So some signs on the child side of things, if they're showing sudden changes in behavior or changes that seem like regression, so if they're losing skills they once had or crying more often or not crying as much as they used to, that could be a sign. If they've not received help with physical or medical problems that has been brought to parents' attention, if they're always watchful as though they're preparing for something bad to happen, if they flinch a lot, if they lack adult supervision, if they're overly compliant, passive, or withdrawn, doesn't respond to situations that seem to warrant a response, or has little reaction to parents at pickup or drop off. So these, combined can maybe indicate abuse and neglect. Now, again, like I said in the last slide, we have to be careful because some of these doesn't really mean that it's abuse or neglect, right? Sometimes I get to my mom's house to pick up my kids, and Jack could care less that I'm there, right? He doesn't have a reaction to me at pickup or drop off. He just wants to keep playing. He just ignores me. That's not a sign of abuse and neglect. So we need to make sure we're putting into context. And sometimes it's also our gut feeling. Listen to your gut, kind of think about what your gut is telling you too. From the parent, if they show little concern for the child, if they deny the existence of or blames the child for the child's problems in the program or at home, um, if they ask caregivers to use harsh physical discipline if the child misbehaves, if they see the child as entirely bad or burdensome or worthless, if they demand a level of physical or cognitive performance that the child cannot achieve, so if they're demanding too much from a child that they're just not developmentally even able to provide, that could be something. And then if they look primarily to the child for care, attention, and satisfaction of emotional needs, right? They shouldn't be getting that from their child. They should be providing that to their child. Now, when we look at their relationship together, if they rarely touch or look at each other, that could be a sign. If they do not respond to each other after a separation, like at pickup or drop off, that could be a sign as well. So we need to talk about what do we do when we suspect abuse and neglect. Asking questions and opening lines of communication. This gets a little tricky, okay? So we'll talk it through. All toddlers get hurt occasionally, right? Bumps, bruises, scrapes, they can all be signs of healthy exploration. Sometimes more serious accidents happen as well, such as a child pulling a cup of hot tea or coffee down on themselves, or if they were in a car accident, some of those things can happen. Sometimes a medical condition can cause symptoms that mimic abuse. For example, there's some skin conditions that leave marks that look like bruises or scars. So to be the most effective at protecting infants and toddlers from child abuse, we must be able to differentiate between accidents and abuse. And one way is having a conversation. Okay, so whenever you notice an injury or a symptom in a child, complete an incident or accident report and ask about the injury. This is a standard part of caregiving, okay? It shows that you take an interest in the child's well-being. But also you have to remember you are not investigating the injury. It is not your job to sit and question the child. You are simply doing what comes natural when someone is hurt, asking what happened and how the person is doing. Okay, so we want to ask open-ended questions like, ouch, that looks like it hurts. What happened? You can show concern and empathy. I bet that was pretty scary for you guys. How did it happen? And make sure it's an okay time to talk and be prepared to get help if the family needs it. Is it okay to ask you about Jerry's bruises? Do you have a minute? That kind of thing. Find out if there is anything else you should know about the injuries. I'm glad you took her to the doctor. Is there anything we should do here to make her comfortable during the day, or is there anything that she shouldn't do? Okay, most of the time, when you, like, if you see something on a kid and you go, oh, that looks like it hurts, what happened? They're gonna tell you, right? If the story matches with the injury, then it probably is an accident, right? They have a scraped knee. They said they fell trying to ride their bike. Makes sense. You know, and then you can talk to mom about it if you need to, like, oh, I put some cream and a Band-Aid on his scrape from his bike or from his scrape, and then see what mom says. Sometimes the parents will approach you right away at drop off and say, hey, this happened last night. His, you know, leg is still pretty sore, blah, 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 blah. So you want to make sure that whatever their story is, one, matches each other's story, right? And then two, that it matches the injury. In most cases, a family member will give you a clear and accurate account of what happened. For older toddlers, you can also ask the child. Okay, infants is a little bit harder. You have to rely on whoever drops them off. If the child's answer and the adult's answers do not match, or if two different adults give different stories about how the injury happened, for example, a child has scratches all over her face. At drop-off, her dad says she got them from a child at a birthday party, and at pickup, her mom says she got them from the family cat. That's a red flag, right? We want to make sure we investigate that a little bit, or we don't investigate, we report it. If the story doesn't seem consistent with their developmental level, so you might suspect abuse of a parent of a 4-month-old climbed out of a crib and got hurt. It's not developmentally realistic for a 4-month-old to climb out of a crib. That just doesn't happen. And then also, like I said, if the story is not consistent with the injuries. So if a child has burn marks on his hands that almost look like gloves, his hands were clearly submerged in something hot. His mother says a child accidentally grabbed a pot off the stove. Accidental burn injuries usually show a splatter pattern as the child pulls away. So again, if it's not matching the story, that's another red flag. Shaken baby syndrome is a form of head trauma and brain injury. It can be caused by violently shaking, dropping, or throwing an infant. Most victims of shaken baby syndrome are under the age of 1, with the average age of the victim being between 3 and 8 months. However, it can be seen in children up to 5 years of age. When babies are shaken, their neck muscles are not strong enough to control their heads, and so this causes the brain to move back and forth inside the skull. And actually, new research has shown that the brain can actually even rotate a little bit. So the result of this is bleeding and bruising of the brain, and the effects are even worse when the shaking ends with a sudden impact, such as when a child is slammed into a crib or against a wall or into a car seat. If you think a child has been shaken, you need to seek medical attention right away. So some different symptoms: if they have altered consciousness, extreme irritability, problem sucking or swallowing, inability to focus the eyes or track movement, lack of smiling or vocalizing, rigidity, inability to lift their head, if they're lethargic, sleepy, if they have any seizures, decreased alertness, pale or bluish skin, unequal pupil size, difficulty breathing, poor feeding or vomiting. Now, again, this is kind of like the injury, right? If you have one of these, it doesn't necessarily mean shaken baby. If you have 3 of these, it doesn't necessarily mean that. These are just some common symptoms to look for. So when we talk about physical abuse, you might see a child who, as an infant, has bruises, but is not yet standing or walking, has burns that take shape of a recognizable object, has burns with clear lines, or no splash marks, has human bite marks, has mouth injuries from forcing a spoon or object into the mouth or forcing a bottle into the mouth, has signs of severe head injury, is always watchful, passive, or immobile, but intently observing as if they are fearful. A toddler or 2-year-old shows all those signs, but also has bruises in unusual places, bruises in the shape of an object, has injuries to the side of face, cheeks, or ears, shows extreme behaviors like being withdrawn or crying more than typical, shrinks at the approach of familiar adults. You might also see a parent or adult who describes a child as doing something on purpose to make them angry, describes a child as evil or bad, uses harsh physical punishment or age-inappropriate punishment, and then also offers conflicting, unconvincing, or no explanation for the injury. So here's some examples. When we talk about familial physical abuse during a diaper change for a 6-month-old baby, her caregiver notices purple, brown, and yellow bruises on her inner thighs and butt. The baby's father says she fell from the crib with the rails up. The caregiver knows the baby does not yet pull up or climb. Or a 2-month-old infant is dropped off in the morning. The caregiver notices right away that his eyes aren't focusing and he doesn't seem like himself. Okay. Institutional physical abuse, this is an example. A staff member in the pre-toddler room had a very hard day. Fiona, who is 18 months old, has been crying and throwing herself on the floor for 10 minutes. It's time to get the kids outside. In frustration, the staff member grabs Fiona by the top of the arm and yanks her up to walk. She squeezes so hard that Fiona has a bruise around her upper arm in the shape of a hand. Another example is a child is fussy and can't stop crying, so a staff member shakes the child. Okay, so those are just some examples. Sexual abuse, you might see a child who demonstrates bizarre, sophisticated, or unusual sexual knowledge or behavior. So this says note that knowing the anatomically correct names for body parts is not considered unusual sexual knowledge. There's a lot of parents like me out there who teach their kids the appropriate names. And I do that because working in child protection, I have seen children who have been interviewed who give nicknames for private parts, and it's really, really hard to figure out what exactly that part is. So a lot of parents have been taught to teach their children the appropriate names. So just because they know the names does not mean they're sexually abused, right? If they have any abdominal pain or pain going to the bathroom, have genital bleeding, pain or inflammation, show sudden change in behavior, that could be some concerns. Some examples of familial sexual abuse: if a child sits and plays with the doll and she touches the doll's genital area and says it hurts, but it's okay. They're acting that out. They're acting out what has happened to them. An 11-month-old boy screams and tries to prevent a bowel movement. So that would be something. A 2.5-year-old who is previously successful in toileting skills regresses and loses all of their skills. So those are some examples. Institutional sexual abuse, a staff member offers to take a child inside for a diaper change. She screams no, hides behind another staff member, screams. A staff member has a favorite child, or a staff member blocks the view of the changing area from other staff members. Those are some examples of could be sexual abuse. You might see a parent or adult who does not respect boundaries or listen when a child tells them no, expresses unusual interest in child sexual development, is unduly protective of the child or severely limits the child's contact with other children or adults, and then makes up excuses to be alone with the child. So these are all things to watch for. Emotional abuse, you might see a child who calls themselves bad, cries excessively, is very withdrawn or aggressive, seems indifferent or unattached to the parent. For parents, you might see somebody who ignores the signs that the child wants an affection, ignores the child or fails to provide necessary stimulation, pressures the child to grow up or perform beyond their developmental level, or rejects the infant's needs. So some examples is if a mother tells her toddler, be good today or I won't pick you up this afternoon. A parent ignores an infant scream for a period of time and then yells at him to shut up. Institutional emotional abuse, examples is a staff member calls a 2-year-old a stupid baby when he has an accident, or a staff member belittles a toddler by saying, even those babies over there can climb the slide, what's wrong with you? So making statements like that. Neglect, you might see a child who eats more than expected at school, such as due to food being withheld at home or not having food at home. If they come in consistently dirty, they lack appropriate clothing for the weather, they lack the need for medical care. As a parent, you might see someone that's indifferent to the child, seems depressed, behaves irrationally or in a bizarre manner, does not provide adequate medical care. And so some examples of these is a father drops his child off every day with a diaper that clearly has not been changed since the previous afternoon. The child's diaper rash is quite severe and parents have not responded to the request for medication. Institutional neglect, a staff member walks out of the room and leaves her coworker out of ratio. A staff member withholds food from child. A staff member notices a child has soiled diaper and does not change the child. A child cries from a crib and a staff member ignores the child. So those are all examples of neglect. Some different medical conditions that can be mistaken for abuse. The number one thing is Mongolian spots. These gray spots are present at birth and often look like bruises. They are usually found on the buttocks or lower back, but they can be found anywhere on the body. They do fade slowly over time, but they can look like bruising. If they have any blood or bleeding disorders, some genetic conditions can cause severe bruising from that. And then if they have bone deficiencies or diseases, some bone diseases causes bones to break easily. And so sometimes they could have a broken bone by doing something that you wouldn't expect would cause a broken bone. Customs and practices that are mistaken for abuse. So some families have rituals or healing practices like coining. The chest, back, and shoulders are rubbed with a medicated ointment, and then a warmed copper coin is rubbed from the top of the shoulders down the back. And dark lines can appear from the pressure and the heat. The marks, which will look like long bruises, usually last for several days. Cupping is a therapeutic technique used to relieve pain in the legs, back, chest, abdomen, or head. This is also something that like massage therapists use. But a small glass cup is held upside down. And this describes a candle is lit inside it. The cup is quickly placed on the skin and a vacuum effect draws the skin up. And then it leaves a circular mark that's left on it for several days and can look like a bruise. Some nowadays, like massage therapists have like heated cups. They don't use a candle anymore, but same thing. So you can see this even in adults that go to a massage therapist. So cupping is another example. So some practices that we can have is getting to know all the children in your care, their families. You cannot recognize a problem if you don't know what is typical for that child. So you want to learn their patterns, temperaments, preferences, and abilities. Talk to their families every day. You know your kids, so you're going to know when something is off. Learn all you can about child development. Some changes in a child's behavior can be startling, but completely typical. For example, it's not unusual for toddlers to have bruises all over their legs or on their heads. It's something that just happens, right? Falling is part of learning to walk, to run. Young children may be scared of certain adults as part of typical stranger anxiety as well. So knowing those developmental stages can help you recognize when a child's behavior goes beyond what is typically expected. Develop respectful communication skills. If you have a concern, ask about it, okay? Ask those open-ended questions. Keep careful records. Your daily health screening can be an important tool for identifying child abuse and neglect. Look for signs or behavior indicators. Write down what you see or hear. Write down adults' explanations for injuries and children's explanations. And then if a pattern emerges, you will have enough evidence to make a report. And then learn about the families of the children that you serve. Some families have rituals or healing practices that might be mistaken for signs of abuse. So learn about that. And then again, learn about your reporting procedures, which we'll talk about in just a little bit. So how to report child abuse. Before reporting, you must decide if the child is in immediate danger. If the child is in immediate danger, you call 911. Okay, now this is information from Beltrami County. I couldn't really find anything online for Leech Lake, but to report suspected abuse or neglect of a child, you would call Child Protection Intake during regular business hours, which is usually Monday through Friday, 8 to 4:30, except holidays. You could call law enforcement 24/7. A written report can be emailed and then sent to this email address or faxed, and then complete the maltreatment report form and email that. Okay, so these are all different things. If the child is in immediate danger, say you are at school and the kid talks about he got hit at home and dad's going to pick him up and he's really scared he's going to get hit again by dad, that's immediate danger. That's when you call 911. If it's something that happened, but there's no harm with them going home because they're not going home with that person or that person isn't going to be home, then you call child protection. So you first have to determine Is it an emergency or is it not? And then that depicts where you call. Now, on the tribal side of things, with Leech Lake, we have our own child protection system. So if the child is Native American and enrolled, you would start by calling Leech Lake Child Protection and making a report there, especially if you're on the reservation, which you guys all are at Head Start. They will determine, they can look up where the child is enrolled at, all that information, and then they will determine if they keep the case or if it needs to be moved on to whatever county you are currently in. And then if it needs to, they'll transfer it out. If you are off the reservation but in Beltrami County, so say you're providing care between Leech Lake and Bemidji, but you're not on the reservation, you would call Beltrami County. But then you would also tell them if this is a Native American child or they're enrolled somewhere, give that information. They should be able to look it up as well. But then if you make that phone call and it's a child enrolled in Leech Lake, lives on Leech Lake Reservation, then they'll involve Leech Lake Child Protection as well. Then there'll be 2 agencies involved. So how to report child abuse. You need to make sure that you have the following information. So the child's name, age, address, and or school. The reason for the report, who the child lives with, any additional information that you might have, the alleged offender's name and their relationship to the child, the parent's name, address, phone numbers, any known tribal affiliation, and then sibling names, their ages, address, or school, okay? This is kind of hard to see, but this is what the Beltrami County report form looks like. So again, it talks about up at top, it's person who's making the report, your position, the date, and your telephone number. The child involved, you would write all their information there, the custodial parent, non-custodial parent, and then any siblings you would list there. On the second page, this is the nature and description of the incident. So date of most recent incident, where the incident happened, what happened. Okay, so please include other siblings of significant or other significant people involved in your report. And then down at the very bottom here, it says, check here if you wish to receive information from social services regarding the disposition of this report. Please be sure to provide your contact information. So if you want to follow up, okay, they will follow up with you. Now, it might just be, yep, we got your report, it's been screened in, we're investigating, or it's been screened out. You're not going to know all of what's happening, right? But they will tell you if it's been screened in or screened out. And screened in means they're investigating it. Screened out means your report is being held, and if they get more information or more reports from other people, then it could turn into a screened in report. Do I need to report? Mandated reporters must report known or suspected abuse or neglect verbally, immediately, or within 24 hours. The verbal report must then also be followed up with a written report within 72 hours. If you are not a mandated reporter, you are still encouraged to report known or suspected abuse or neglect of a child to child protection or law enforcement. So there are 2 things that you need to think about is you have to report verbally within 24 hours and by a written report within 72 hours. So making that phone call, making that oral report, and then you need to also send a written report within 72 hours. It's also important to note that you cannot be held liable for any report of suspected child abuse or neglect that you make in good faith. Okay. Under Minnesota law, you are immune from liability if the report was made in good faith. Now, if you start making reports because you don't like the mom or you don't like the dad and there's no validity to it, that's a different story. But if you're making a report out of good faith that you think something happened to this child, you will not be held responsible for anything. And then here is a link to the resource guide for mandated reporters. So I can put that in our Canvas too if you want to take a peek at that, but it's also on the Beltrami County website. Reasons to report. So Beltrami County Health and Human Services is responsible for screening, assessing, and investigating reports. They're dedicated to achieving positive outcomes for children and families. So sometimes if a report is screened in, it might go to voluntary case management. That's where we understand the family needs services and the family accepted services, and they're working with them to correct the issue. Not all the time are kids going to be taken out of the home or parents going to be penalized. That's the very last resort, is out of home placement. After the report is made, so there's two different responses. Investigative, which is designed to respond to reports of substantial child endangerment or neglect. Investigation means that they're fact gathering related to the report and determines whether that maltreatment occurred or not, and whether they need child protective services. The other route is family assessment. So these are reports that don't involve substantial maltreatment. And this is more likely for child safety, risk of child maltreatment, and then the family strengths and needs are applied to child maltreatment report that does not allege that substantial child endangerment happened. So this is where like family needs support, family needs education or something to help strengthen that family. Common concerns. These are common things that we hear. We live in a small community. Will my report ruin the parent's career? I don't want to turn in my coworker. What if I'm wrong? What if it's not abuse? The number one thing that you have to remember is it is your duty to report, even if it is just a suspicion. You are not responsible to investigate the situation. It is your role to report observed and suspected abuse and neglect, and it's your responsibility to keep children safe. Will they tell the family I was the one to make the report? No. Parents are never told who made the report. Now, granted, parents can try and figure it out themselves of like, oh, well, my kid was here and here this day, so it's got to be this person or this person. Like, they might be able to figure it out on their own, but it will not be told. So these are different strengthening protective factors that we can do through everyday actions. So parental resilience, showing families they are valued, encourage families to manage stress, help parents have a positive attitude toward parenting, all of those things. Social connection, helping families build and sustain social connections, modeling developmentally appropriate interaction and guidance strategies with children, responding immediately when families are in crisis, and then helping parents foster their child's social emotional skills. I'm not going to read through all of these things, but you can hit pause and read them. Trauma. All families experience trauma, and they all experience them differently. For some families, past trauma may cause them to feel stressed, overwhelmed, less able to function as well as a family unit, while others demonstrate resilience. So trauma can influence how a family interacts with you. Families that have experienced trauma may find it difficult to build trusting relationships with you, and it might not be easy for them to trust anyone. Families might perceive aggression or danger where it does not exist. They may struggle with keeping themselves or their children safe, and you might find yourself questioning their decision-making. They may abuse drugs or alcohol. They may have a hard time controlling their emotions, and they might seem numb or shut down. Different ways we can help strengthen and support families that have experienced trauma is promoting safety for all family members, focusing on their strengths and assets, connecting families to community resources, educating families on stress and the impact of stress, and then building social connections amongst families in your program. Some different ways we can prevent child abuse and neglect in our center settings is by different facility operations, hiring and staffing procedures, looking at our group size and accountability, guidance and discipline policy, our admission and release policy, and our open door policy. Those are all ways we can help prevent child abuse. Another thing that I have kind of talked about with you guys is adverse childhood experiences. This is a research study that has come out a while ago, but it's still relevant. But they are stressful experiences that can happen to any of us before we turn 18. They're not our fault, and we don't have control over when or why they happen. They can be a single event or an ongoing struggle where our safety, security, trust, or sense of self is threatened or violated. The original ACEs study included 10 types of stressful or traumatic events. And so it was physical abuse, emotional abuse, sexual abuse, physical neglect, emotional neglect, and then different household challenges like divorce, incarceration, substance use, domestic violence, or mental illness. They've also looked at kind of beyond the 10 ACEs, if there was discrimination, poverty, racism, other violence, including community violence, different intergenerational and cultural trauma, separation, adjustment or other major life changes, bereavement and survivorship, and then adult responsibilities as a child is another thing that can happen to us. And so what these are, they are potentially traumatic events that occur in childhood between the ages 0 to 17. So some of these can include experiencing violence, abuse, or neglect, witnessing violence in the home or the community, having a family member attempt or die by suicide. Also, this can include aspects in the child's environment. So like if they have a parent or a household that has substance use problems, mental health problems, instability due to parental separation, or instability due to household members being in jail or prison. ACEs are common. 3 in 4 high school students reported experiencing 1 or more ACEs, and 1 in 5 experienced 4 or more ACEs. ACEs that were the most high or most common among high school students were emotional abuse, physical abuse, and living in a household affected by poor mental health or substance use. Preventing ACEs could help reduce health conditions. So for example, preventing ACEs could reduce suicide attempts among high school students by as much as 89%, prescription pain medication misuse by as much as 84%, and persistent feelings of sadness and hopelessness by as much as 66%. Additionally, preventing ACEs could also reduce many health conditions in adulthood, including chronic diseases and behavioral health conditions. Estimates show that preventing ACEs could reduce cases of heart disease by 22% and depression by 78% of adults. So they're saying if you have experienced some of these ACEs, you are at higher risk of health conditions. And so by being able to help kind of prevent that on the front end of educating parents about their children can help prevent ACEs. Some people are at greater risk of experiencing 1 or more ACEs than others, while all children are at risk of ACEs. Numerous studies show differences in such experiences. So these differences are linked to the social and economic environments in which some families live. It has been shown that ACEs are highest among females, American Indian or Alaska Native and multicultural youth, and gay, lesbian, bisexual, or questioning youth. Some risk factors is if you're a child younger than 4 years of age, a child with special needs could help, which then increases caregiver burden. Families that have household members in jail or prison, families that are isolated from and not connected to other people, families experiencing other types of violence, including relationship violence, and then families with high conflict and negative communication skills. Different protective factors that we can help families with is caregivers who create safe, positive relationships with children, caregivers who practice nurturing parenting skills and provide emotional support, caregivers who can meet basic needs of food, shelter, educational, and health services, caregivers who have a college degree or higher and have steady employment, families with a strong support network, families where caregivers are present and interested in the child, families where caregivers enforce household rules and engage in child monitoring, and then families with caring adults outside the family who can serve as role models or mentors. So some prevention is, creating safe, stable, nurturing relationships and environments is essential for helping children and families thrive. These relationships and environments also help protect children against or lessen the negative effects of violence. So safety is defined as the extent to which a child is free from fear and secure from physical or psychological harm. Stability, having a degree of predictability and consistency in their social, emotional, and physical environment. And then nurturing, the extent to which a child's physical, emotional, and developmental needs are sensitively and consistently met. Everyone has a role to play in preventing child abuse and neglect and helping all children reach their full potential. Now, there is a thing, like you might have an ACE, right? Like my parents were divorced. But if you have these protective factors in place, it can really lessen the consequences of that ACE. So just because our kids or we experience some of those doesn't mean we can't bounce back from that. Young children experience the world through their relationships with parents and other caregivers. So the quality of these relationships and environment play a significant role. So we want to make sure that we're setting aside time each day to talk or play with your child, establish routines, validate your child's feelings, know who is supervising your child when they're outside the home, Teach your child how to stay safe when they're online or on digital devices, and then seek parenting skills and training programs to help build stronger relationships with your children. These are some different links for ACEs. I will post them in our Canvas as well. And then the rest of my presentation is some videos. So I'm actually going to post those videos on Canvas for you. But I would like for you to watch this removed stats and then removed part 1. If you want to watch removed part 2, you definitely can. But I will post those on our Canvas for you to watch. In order to get your time for watching this presentation, I need you to send me a text or an email or a message through Canvas, one thing that you learned about child abuse and neglect. Once I get your response, I will update your hours to include 2 hours of time. So your job is to watch the videos that I link in our Canvas. Send me, whether it's text, email, or through Canvas, one thing that you learned about child abuse and neglect. If you have any questions about anything that I talked about, I want you to send me those questions. This is something that I am really passionate about and have a lot of information and knowledge on. So if you have any questions, please reach out.